Welcome, everyone. We are so glad to have you with us today for a very special presentation, Cannabis and the Young Brain with Dr. Tauheed Zaman. Today, we have over 250 people registered for this important workshop, so we know that this is a timely conversation, especially now as we've been at home with our kids, most of us for a year, and schools are starting to reopen and kids are heading back to school, so a very important topic. If you would like Spanish interpretation today, we have with us Cynthia Hinestrosa, who will be doing simultaneous Spanish interpretation. At the bottom of your Zoom screen, you will see a globe icon. To hear in Spanish, click on the globe and Espanol, Spanish, and then you will hear Cynthia. All right. Again, we really would like to thank our sponsors today, in particular the San Mateo County Office of Education Tobacco Use Prevention Education 2-Pay program, and along with the Sequoia Union High School District, Sequoia Healthcare District, Peninsula Healthcare District, and nonprofit, the Parent Venture. Special thanks to our presenter today, Dr. Zaman, who is with us, back by popular demand. We actually offered this presentation a few years ago, but as he said, it's time to update. Research has changed, what we know has changed, and so we're really excited to hear what he has to say today. So Dr. Zaman will be speaking for about 40 minutes, and then we really want to open it up to questions from you, the audience. So today we ask that you put your comments in the chat and questions in the Q&A. If you can, keep those questions kind of brief because we want to get to as many of them as we can, but we will promise to save time at the end of the presentation for questions. Dr. Zaman will also be asking you a few questions in the presentation along the way, so you can use your chat button to put the comments there too. Feel free to reach out to one another or to us, the panelists, if you have other comments. My partner, Bev Hartman, will be sharing relevant links in the chat, so do look for those links as the presentation proceeds. Today's webinar will be recorded and available soon on our video library. We work with students from the media production team at Boys and Girls Club of the Peninsula. It usually takes them a few days to get the video ready, but again, it will be posted to our free video library. There's also a special section on the library for Pláticas en Español if you are a Spanish-speaking attendee. Our next event actually is tonight at 5:30. We're going to be offering Mental Health 101, When Should Parents Seek Help? That is with Dr. Shashank Joshi, the Director of School and Mental Health at Stanford University. So if you have time, again, join us tonight at 5:30. Alrighty, let me tell you a little bit about today's keynote presenter. Dr. Zaman is an addiction psychiatrist at the San Francisco VA and Kaiser San Francisco. He is also an associate clinical professor at UCSF and serves as Associate Director of the university's Addiction Training Program. He serves in several leadership roles within the California Society of Addiction Medicine and has been involved in cannabis-related policy, research, and clinical work. Dr. Zaman completed his addiction training at UCSF and his psychiatry residency at Harvard Medical School. Please join me in a very warm virtual welcome for our friend, Dr. Tauheed Zaman. Tauheed, take it away.
Thank you, Charlene, for that kind introduction, and thank you to all of you for being here. I'm glad to be able to return and speak on a topic that I think is increasingly relevant for all of us, particularly as kids go back to school. So I'm hoping, Bev and others, you can display my slides for me such that I can see them and the audience can see them, and then we'll get going. Terrific. Now I am only able to see part of the slide. There we go, that fixed it. I wanted to begin by sharing this photo of Haight-Ashbury. And so I actually lived in the Haight for a long time in San Francisco. And as an addiction psychiatrist, found it interesting to be surrounded by people of all ages using different cannabis products, including many adolescents. And this was a good reminder for me that even though we're talking about some of the science and some of the kind of legal issues a little bit more recently, that really cannabis has been amongst our communities and amongst adolescents for a long time. Next slide, please. There we go. I have no conflicts of interest to disclose related to this presentation. However, I should say that cannabis has been controversial for a long time now, particularly in terms of legalization for recreational use among adults. I will not be resolving all of those controversies today. However, I will be talking about some of the data related to adolescent use and hopefully empower you with some good data and some good tools. Next slide, please. At the end of this talk, I hope that you, the learners, will be able to describe some of the trends in adolescent cannabis use, list some of the common cannabis products and their contents, understand risks posed to the developing brain, again, the adolescent brain. I'm really not talking as much about adults here, and then describe some of the treatment and harm reduction approaches that might be available for someone who might have an issue with cannabis. Next slide, please. I think it's always helpful to talk about these issues in the context of a case. And so I thought I'd share one with you. This is the case of Adriana, and that's not her real name, but it's what I'm using here. At the time I met Adriana in our clinic, she was 17 years old and a cisgender female. She was a high school senior at the time. She'd been struggling with anxiety and was considering therapy or medications to help with her anxiety. She let me know that she was using alcohol sometimes kind of 1 or 2 weekends a month with her friends. However, she had been using an escalating amount of marijuana. So she had gone from smoking joints on some weekends with friends to now actually daily vaping and or using an edible because she had an older friend who had access to those products. And so she let me know about that. And I expressed some concern saying, gosh, you know, it seems like your use is going up. So what do you think about that? Next slide, please. And this is what Adriana said to me. She said, well, everyone smokes, especially the seniors at my school. Maybe it's just the stress of college coming up, right? So I think this is a common scenario, and certainly many of us can empathize with the stress portion of this. But it did make me wonder, is everyone actually using, particularly high school seniors? And what does this look like in high school? Next slide, please. This brings us to my first question about high schoolers for all of you. This is Cannabis question 1. And please feel free after I read the question to take a few seconds to take your best guess and type it right into the chat. Here we go. So compared to 8th graders, 12th graders report the same levels of past year and daily use of cannabis, B, the same levels of past year use, but more daily use, C, the same levels of daily use, but higher past year use, D, higher levels of past year and daily use, or E, none of the above. And feel free to take your best guess here. We'll give you all a few seconds. I see a number of Ds. Okay, I see a C or 2 in there as well. Thank you all for taking a guess. So, as with all of these questions, I'm confident you will know the answer by the end of this section. So let's continue, and thank you for those of you who've taken a guess. Next slide, please. When we look at past year illicit drug use for all people over the age of 12 in our country, this is from a large national survey called the NASDA from 2018, we see there on the left that really about 19% or so report past year illicit drug use. That's that kind of blue wedge of the circle. Now, when we expand that to look at what drugs they're actually talking about, we actually see that marijuana is by far and above the most commonly used illicit drug. Now, of course, they are using the term illicit, and I'm using the term illicit here in the sense that it is still considered an illicit substance on the federal level. It's still considered a Schedule 1 or highly restricted illicit substance, but marijuana basically is quite common, and that's the takeaway here. Next slide, please. When we look at use amongst adolescents, there are some interesting data amongst 8th, 10th, and 12th graders. And this, again, is national data. And when we look there on the left at past year marijuana use, we actually see that past year use has roughly stayed flat over the last 10 years or so, so 2010 through 2020. And you can see that 8th graders are there in blue, 10th in red, and 12th in purple, that past year marijuana use tends to go up as you go up in grades or advance. Similarly, with daily marijuana use there on the right, it stayed roughly flat. However, you can see that the rates go up from 8th through 12th grade. Next slide, please. And then interestingly, I'm always kind of curious what happened during the pandemic to cannabis use. And what we see when we look at kind of the last few years of past year marijuana vaping, again, this is specific to vaping as a form of use, you can see that that's actually gone up amongst 8th, 10th, and 12th graders just as a form of use. So more adolescents, or at least high school students, are vaping. However, there on the right, you see that daily or near daily marijuana vaping decreased amongst 10th graders from 2019 to 2020. So you can see particularly it decreased amongst 8th, 10th, and 12th graders, but most dramatic amongst 10th and 12th graders. And who knows, this may be partly related to being at home during the pandemic, not having access, having more parental supervision. But the pandemic has certainly had an impact on regular use. Next slide, please. It's really important, I think, to know some local data. So this is California specific data, and this shows past month adolescent marijuana use pre and post legalization of recreational marijuana for adults. So you can see that the trends show amongst 7th, 9th, and 11th graders, those are those 3 lines on the left, you can see that the past month use of cannabis was actually steadily decreasing from 2010 through 2017. Again, this is past month use. However, after legalization, you can see that time point, rates have started to go up. So post-legalization rates of adolescent marijuana use, past month use, have actually gone up. Even though legalization, of course, was for adults, it wasn't for adolescents. So why might this be? Next slide, please. Well, it may have something to do with perception of risk. When perception of risk goes down in a community overall, perhaps due to legalization, advertising, etc., whenever perception of risk goes down, daily use amongst adolescents goes up. And there are some convincing data around this. This is from the very large Monitoring the Future study out of the University of Michigan. And what we see is the percentage of US 12th grade students who report daily use, again, not just once in a while use, but daily use, versus how many of them actually perceived risk of regular marijuana use, that the fact that it was risky. And you can see over time, and these are data over about 35 years or so, that as perceived risk goes up, daily use goes down, and as perceived risk goes down, daily use goes up. So we should be cautious that perception of risk can be affected by legalization, and that can impact use amongst adolescents. So that's the takeaway here. Next slide, please. And so returning to our question, I promised you all would know the answer. And so let's do the next slide so we can take a look. And so the correct answer should come up as the letter D. So next slide, please. There we go. So those of you who guessed D, which I think were the majority, are exactly right. Past year and daily use goes up amongst 12th graders compared to 8th graders. So I brought this up with Adriana, and what Adriana said was that it's labeled just like a medication. So I pretty much control what's going into my system. And so this was an interesting point, because she really wanted to control what was going into her system and that valued that. And so said, how is that any different from my regular medications? I see in the comments that someone was having trouble hearing me. If anyone else has that difficulty, please let us know. And so I wanted to respond to Adriana. Do we actually know what's in these products? And do we know if the labeling is accurate? So next slide, please. Well, this brings us to our question. What's exactly in there? So my question for you all is, the cannabis plant contains how many different compounds or cannabinoids? Is it 1 through 5, 10 through 50, 51 through 80, 81 through 100, or over 100? And please take your best guess in the chat. I see some of you are ahead of me. You've already started guessing. There's a question mark in there. Yep. So take your best guess here. And I'll warn you, kind of similar to those multiple choice questions, many of the high schoolers take, these questions get harder as they go. So I see a lot of guesses for D, B, C, and E as well. Okay. Excellent. Well, thank you for your guesses, and let's circle back to this question after this next section. And no idea. Thank you for your honesty about that. That makes total sense to me, and the answer surprised me as well. Next slide, please. So this is a picture of trichomes. The word trichome comes from the Greek word for hair and refers to the small translucent outpouching that you can see on this microscopic view of the cannabis leaf. And the reason I share this with you is that all of the chemicals that are secreted by glands within the plant are found in these trichomes. So every cannabis product has found some way of taking the chemicals from these trichomes and putting them into a form that can be consumed. Next slide, please. And there are different strains of this plant. So many of you may have heard that there are strains, a couple of strains, sativa and indica, which have different levels of THC and CBD, and also many, many hybrids over the years. Next slide, please. However, it's important to know that the potency in terms of the THC or tetrahydrocannabinol content has really changed over time. So this graph shows you from 1995 through 2019, the percentage of THC and CBD in cannabis samples seized by the DEA. And so what is really interesting here is you see that THC there in the red has gone up dramatically since the mid-90s to more recently, and CBD has actually flattened and been decreased. So what I tell people is that that the cannabis that's out there now, that the adolescents may be using, gosh, this is certainly not your parents' generation of cannabis or your grandparents' generation of cannabis. What's out there is on average quite a bit more potent, and I think that's important to know. Next slide, please. So what's in there? Well, we certainly talked about the tetrahydrocannabinol or THC and the CBD there on the top, but it turns out when you look at the content, there are an entire basically alphabet soup of different chemicals that are in there, different cannabinoids. And so but the majority of those have not yet been well studied. In fact, even THC and CBD are still being studied. So I think it's important for folks to know that, gosh, yes, we may have a sense of how much THC and CBD are going into your system, but there probably are many other chemicals that we just haven't studied yet accurately. Next slide, please. And what do these preparations actually look like? So many of you may be familiar with these, but I wanted to do a quick overview of the common preparations. So there's certainly the marijuana dried plant product itself. There's hashish or hash, which is a concentrated resin cake that can be ingested or smoked. That is made by dry sifting the plants and removing the chemicals from those trichomes we looked at and putting them into this consumable solid form. There are tinctures, which are basically liquid extracts, and those can be used sublingually under the tongue. And then there's the most concentrated form, which is hash oil or hashish. And that is basically oil obtained by using solvent extraction, which means that someone can use a highly volatile solvent, dissolve the chemicals off the surface of the plant, and then evaporate that solvent to leave this kind of sticky oil, which is highly concentrated in terms of THC and sometimes referred to as dabs. As a side note, trying to do this at home or kind of informally has led to fires and explosions, which have sent folks to the emergency room, and that's just something to be aware of. However, most people are not trying to make hash oil themselves. Finally, there are infusions, which are plant materials that can be mixed with butter or cooking oil and put into a variety of different products. Next slide, please. I wanted to share this photo of a dispensary. I did not take this photo. I have not been there, but found it online, and it reflects how nice some of the cannabis dispensaries can be, where some of these products are dispensed, and just wanted to share a visual of that with you. Next slide, please. And then here are the actual products. And so they really run the gamut from, candy to vape pens to dried plant products. And, when it comes to the candy forms, gummy worms, gummy bears, these can be particularly risky for younger adolescents and for children. There have been a number of cases of children getting into adults' edible gummies or worms, and that can be quite risky. And children have ended up in the emergency room with accidental overdoses. So whenever I hear of someone using those kind of candy-appearing forms, I talk about the importance of safety and of safe storage. There are certainly the vape pens there on the top right, the bottom kind of plant products that one could consume. And I think someone mentioned, yes, for dogs too. Yes, for animals in the home, this can be risky. Next slide, please. And then, of course, there are the entire range of other products that are now more and more available with cannabis extracts. So that includes potato chips, brownies, cookies, cooking oil, all kinds of different products. And really, the diversity of products is marketing. This is meant to appeal to a broad market or a broad set of consumers. Next slide, please. Speaking of marketing, there are some concerning parallels between tobacco and cannabis marketing. So in fact, many tobacco companies actually have a huge stake in new cannabis companies, and the marketing strategies are very similar. And so I won't go into this at length, but wanted to share this telling quotation from George Weissman, the president of Philip Morris back in 1970, who said, while I am opposed to its use, I recognize that it may be legalized in the near future. Thus, with these great auspices, we should be in a position to examine, number one, a potential competition, number two, a possible product, number three, at this time, cooperate with the government. So just a note to remember that tobacco companies have been aware that cannabis legalization was coming for a long time, and the current marketing looks similarly concerning. Next slide, please. Synthetic cannabinoids are out there. They often come in these very bright packages and are often referred to by kind of the terms you see there. I often hear about Spice, K2, Joker, Mamba. Those are some of the common names I've heard. I have very few absolutes when it comes to substances. However, this is one of them. No one, adult or adolescent, should be using synthetic cannabinoids. These are incredibly potent synthetic chemicals that, when they get into the system, can cause dysfunction of multiple organ systems, including renal failure, cardiac problems, liver problems, and they have psychiatric effects. So they can cause psychosis, they can cause seizures, so a concerning neurologic effect. And these substances do not show up on most urine drug screens, so you have to test for them separately. So I think it's important to ask about and encourage everyone, including adolescents, not to use synthetic cannabinoids. Next slide, please. And then finally, there are these other preparations that have shown up in my office over the years, and these are a couple of photos I took right in my office. And you might notice these look different from those kind of more colorful, bright packages that are marketed. And these look more medicalized. These look like prescription medications, even though they're cannabis products and meant to appeal to a different audience. And in fact, if you look closely on the bottom left, you'll see that it's labeled with the percentage THC and the percentage CBD, which led me to wonder, do we actually know how much THC and CBD is going in? We know that there are many other, over 100 different chemicals in there, but maybe the THC and CBD levels are perfectly adequate. And Adriana is right that she knows what she's getting. Next slide, please. It turns out label accuracy, or rather inaccuracy, has been studied. So I wanted to call out this study that was in JAMA a few years ago. where a group of researchers went to 3 different cities on the West Coast and collected every edible cannabis product they could find and tested it for how accurate the labels were within, I believe, 5% compared to what was actually in the product itself. And they looked at THC content and found that only 17% of the products, and these are edible products, were labeled accurately. Now, I think that is getting better. I think there's more infrastructure and more oversight of testing. However, we should know that cannabis products can be quite grossly inaccurately labeled still. Next slide, please. And so returning to our question, cannabis question 2, the cannabis plant contains how many different compounds or cannabinoids? Let's go to the next slide, please. The answer is over 100. So I think a good chunk of you got that. And I have seen some reports out of kind of research labs saying that it may be up to 500 different cannabinoids, many of which we have not had a chance to share. Next slide, please. So then Adriana said, okay, well, there's a lot of stuff in there, I get it, but I'm almost 18 and I thought it was okay for adults to use. And so this gets to our definition of what we think of as adulthood versus adolescence from a neurologic standpoint. Next slide, please. It also gets us to our cannabis question 3. And so one of the harder ones, but I trust this group to take your best guess. What is the last part of the brain to finish developing or myelinating? Myelinating refers to the process by which the kind of protective sheath forms around our nerves, which is a gross oversimplification. So is it A, the cerebellum or the motor part of the brain at 18, the frontal cortex, which is involved in executive function at 21, C, the limbic system, emotional at 21, frontal cortex or executive function at the age of 26, or is it E, the limbic or emotional region at 26? I see many, many guesses of the letter D, which makes me suspect that many of you have some prior knowledge of this topic or medical or scientific backgrounds, which is excellent, but I won't spoil the answer. We'll return to it. Next slide, please. So the brain actually myelinates from the back to the front, and there on the right, you can see the myelination happening as the brain turns blue, kind of starting from the back to the front, and the order in which this occurs is really important. Next slide, please. The cerebellum, or the motor part of the brain, develops from the ages of 12 to 14. That's the kind of back part of the brain. That's why we see these incredible and amazing young athletes at the Olympics and elsewhere able to do kind of all of these kind of motor complex and advanced motor maneuvers. Next slide, please. The limbic or social emotional part of the brain develops a little bit later, 14 to 18. So this is a lot of kind of peer groups, first crushes, that kind of thing. And then next slide. Finally, the frontal or the prefrontal cortex, which we associate with executive functioning, which is all of the kind of components of being a good citizen or a model person that we think are important. So, impulse control, decision making, planning, all of that develops between the ages of 18 and 26. And so it's important to know that some of the most important parts of the brain are actually not fully developed until much later than what we typically think of as adolescence, till the age of 26. And so it can be particularly important to protect the brain longer than we would think. Next slide, please. And of course, THC exposure can affect development. So many of the studies of adolescence and cannabis are studies of association, not cannabis causation. However, what we know is that THC receptors can affect neural development. I won't go through this diagram at length just in the interest of time, but will say that for those of you who are interested, THC receptors, CB1 receptors, are found on presynaptic nerve cell membranes, and they can affect the release of many other neurotransmitters, including GABA, which are known to affect neural development. So there may be a causal effect there in terms of THC affecting neural development. Next slide, please. And these receptors, so CB1 receptors for THC, are actually located in every part of our nervous system. I apologize if the text is a little small here, which means that really THC exposure can affect many different potential functions of the brain and the nervous system. Next slide, please. And so returning to cannabis question 3, what is the last part of the brain to finish developing or myelinating? Next slide. This group is particularly astute. I'll say this is usually the hardest question for most audiences, but you all are on top of it. The answer is the frontal cortex or prefrontal cortex and executive function at the age of 26. So really important to protect the brain until that can happen. Next slide, please. And so Adriana said, okay, but if it helps with my anxiety and it doesn't affect my schoolwork, it should be pretty safe, right? And so this brought up the question of, okay, is it actually indicated for anxiety? Many state laws actually do allow medical marijuana prescriptions for adults for anxiety, but is it safe? And how do we think about safety, particularly with adolescents? So let's talk more about that. Next slide, please. This brings us to cannabis question 4, which is that the FDA, the Food and Drug Administration, has approved cannabinoids for use in which of the following medical conditions? Is it A, anxiety disorders, B, glaucoma, C, certain seizure disorders, D, complications of chemo and AIDS, or E, pain and multiple sclerosis? And I'll tell you, I see patients with many of these conditions, so I get these questions frequently. Please take your best guess. Maybe all, okay. Yep, I see a couple of alls, and then the others I see C's and D's, but a pretty good distribution overall. I see a couple of alls. Okay, let's come back to it. This is a hard question, so next slide, please. So important to know psychiatric and non-psychiatric indications. So I was actually with the American Psychiatric Association in 2013, where we did this year-long review of all of the research, and at the end said there were no current psychiatric indications for which a cannabis-derived product was appropriate. However, we were quite careful to say this was not because of many negative studies showing that it wasn't effective. It was just that studies were lacking, and so more study was absolutely warranted. However, in 2018, the American Psychiatric Association reviewed that statement again and actually reiterated its opposition to the use of cannabis as a medicine for psychiatric conditions, including anxiety, as Adriana mentioned. However, it's important to know that there are some FDA-approved non-psychiatric indications for which cannabinoid or cannabis-derived products can be prescribed. So that includes nausea and vomiting related to chemotherapy, anorexia and wasting related to HIV, and some rare childhood forms of epilepsy. Next slide, please. So these are just some of these are the FDA-approved cannabinoids. I won't go through these at length except to leave this here for your reference, but dronabinol, nabilon, and cannabidiol are approved for the indications there that you see on the right related to HIV, chemo, and some rare forms of childhood epilepsy. Next slide, please. So what about adolescent use and outcomes? So these are studies of association. However, over time, there have been increasing concerns about associations with cognitive issues, so both short-term and long-term cognitive issues, which can affect school performance. There's an association with reduced life satisfaction, and then some safety concerns related to impaired driving. I hear from a lot of adolescents that they think driving high is not risky because it just kind of slows you down, but it turns out it also slows down your reflexes in a way that can be quite risky, and particularly risky combined with other substances such as alcohol. So alcohol and cannabis have a combined additive effect on driving and motor vehicle accident risk. There's also an association with severe nausea and vomiting. Many of you may have heard of cyclic vomiting or cannabis hyperemesis syndrome, which I've seen a number of times, particularly with adolescents who use heavily or daily. So those associations are quite concerning. Next slide, please. And there are also age and dose-dependent associations with a number of outcomes. This is from an excellent review in Lancet, kind of a major psychiatric and medical journal, which found that there were associations with kind of rates of high school completion, university degree attainment, rates of physiologic dependence on cannabis, illicit drug use, suicide attempts, depression, and welfare dependence. Now, I share this with trepidation, and I want to pause for a moment because I want to make it clear to this audience that I do not believe in scare tactics, and therefore do not read this list of possible associations out to my adolescents or really any patients. However, if someone has particular risks, so for example, if someone has a history of depression or suicide attempts, if someone is using other substances, if someone is, trying to do as best as they can in school, they really want to graduate high school and get a job and get out of the home. I talk about these associations in a targeted way rather than kind of hit people over the head with the scare tactic of sharing every possible poor outcome related to cannabis. However, I think it's important to have access to and share the relevant information. Next slide, please. A lot has been written about cannabis and psychosis, and by psychosis, I mean psychotic episodes, schizophrenia, and schizoaffective disorders. Cannabis exposure increases the risk of a psychotic outcome. So that's hospital room visits, hospital admissions, et cetera, related to psychosis. There's a dose-dependent risk. For adolescents who have a family history of those conditions, it can speed up the onset of symptoms by about 7 years on average. And there can be higher rates of paranoia, hospitalizations, lower brain volume. However, the more recent data actually say that it's unclear. This is a study of association, so unclear if this is bidirectional. Could it be that adolescents and young adults with those conditions are just more likely to use cannabis? We're not entirely sure, but there is this increased concern with psychotic disorders that I think it's important to know about. Next slide, please. In terms of the addiction risk, these are the best data I could find in terms of all users. Really, the minority end up developing an addiction at any point in their lives. That's 9%. However, for those who start as adolescent users, that risk goes up to 17. And for daily users, depending on the study, it goes up to 25 to 50% developing an addiction at some point in their lives. Next slide, please. And we have diagnoses. We, as physicians, we use the Diagnostic and Statistical Manual to actually give people medical diagnoses. And these are diagnoses that we have criteria for. So, cannabis intoxication and withdrawal and use disorder. We use the term use disorder rather than abuse or dependence, which are the outdated terms at this point. Next slide, please. And so the FDA has approved cannabinoids for use in which of the following condition? This was the trickiest question off the bunch, but several of you did get it right. Next slide, please. This is a rare double answer. So I tricked you all a little bit. The answer is certain seizure disorders that I noted, childhood forms of epilepsy, and then complications of chemo and AIDS. Next slide, please. So Adriana said, okay, well, if I did want to cut down, I'm not ready, but if I did want to cut down or stop, is there something that would make it easier? And there are things that make it easier for someone who wants to or needs to. Next slide, please. Pharmacotherapy, first of all, or pharmacology, there are currently no FDA-approved medications to help people come off of cannabis or deal with the withdrawal. However, there are small trials of off-label medications, and also treating the co-occurring disorder can be really helpful. So if someone also has depression or anxiety or insomnia or ADHD, treating those conditions can make it much easier to get away from the cannabis as well, which is really important. Next slide, please. A lot of the treatment, however, is behavioral, by which I mean group or individual therapy. There's no one best modality, but there is good evidence for CBT or cognitive behavioral therapy, motivational interviewing, contingency management, and group therapies. And group therapies really are the mainstay of treatment for someone who's struggling with a cannabis-related issue, including adolescents. So just wanted to make sure I mentioned that. Next slide, please. And this is what happened with Adriana. I'll tell you, in the end, she said, I'm not ready to stop, but I'll think about it, and we can keep an eye on my anxiety and grades. And I will say, as a physician, this was a perfectly acceptable outcome for me, because the most important thing is that I can talk to all of my patients, including adolescents and their parents, in a non-judgmental and very transparent way about what's going on. So she did actually, I will say, as a part of our conversation, she did actually end up doing psychotherapy to help with her anxiety. Did not end up taking any medications for anxiety, though she always knew that was an option as well. And her anxiety improved. She did cut down enough on her cannabis use that she started doing better in school and actually graduated shortly before we wrapped up our treatment together. So even though she never got to abstinence, we were able to take this harm reduction approach. Next slide, please. Can I get the next slide? Thank you. Harm reduction is important. I think abstinence is really the best way to avoid health risks. However, if someone is not ready to stop or able to stop right away, I think it's important to consider harm reduction. That can include avoiding early age of initiation. Again, we want to protect the brain to the age of 26 if we can, avoiding high frequency, basically daily or near daily use, trying to use lower potency products, staying away from synthetics. For people who have lung issues, asthma, bronchitis, et cetera, I think it can be helpful to avoid combustible products, avoid a lot of deep, risky inhalation, abstain from cannabis-impaired driving, which is such a safety concern. And then high-risk populations should probably avoid cannabis altogether. So those with a history of psychosis or addictions for themselves or in their families. And then I think it's really important to track use over time, including some metered dosing pens, which can make it easier to kind of track how much you're cutting down. Next slide, please. Some take-home points that I'd like to leave you with before I share my references and take some questions. So cannabis overall can be risky for adolescent brain development in the ways we talked about. Early and daily use is associated with poorer outcomes. The cannabis plant contains THC, CBD, but also over 100 different other compounds, as we saw in our questions. We have medical criteria for intoxication, withdrawal, and use disorder, which is cannabis addiction. And it's important to know that doctors can make the diagnosis. Individual risks can really differ. So someone may have a personal history of addiction or psychosis that makes them more vulnerable. And treatment is largely behavioral, so therapy, and there are some off-label medications that I do prescribe and that others do as well to help. There are some medical, but no current psychiatric FDA approved indications. Harm reduction is crucial. And then finally, you heard me mention kind of legalization and marketing in the tobacco industry, which always brings up the question of how do we protect adolescents from the effects of that marketing? What about other vulnerable populations? I work with veterans, for example. And also, how do we conduct research on a restricted substance that can be challenging to do when it's federally considered a Schedule I restricted illicit substance? Next slide, please. Here are some additional public-facing and very accessible resources from the CDC, NIDA, and CSAM that you're welcome to kind of take a look at if you're interested. Next slide, please. And with that, I'm happy to take any questions and want to share that after this slide, there are also 3 additional slides of references related to my talk. So thank you all very much, and I'm glad to take any questions.
Well, thank you, Dr. Zaman. That was incredible and so much to think about. And we have so many great questions coming in. So we're going to do our best to get to as many of them as we can. We're going to leave this slide with references up so that you can look at it. And again, we want to apologize. This just kind of been a tough day for technology. Eventbrite is also down, which has never happened during event. So those of you who tried to log in through Eventbrite could not. We apologize. The good news is that this is being recorded and will be available on our video library. Many of you have mentioned you'd like to show it to your kids, show it to a partner. We have some community experts actually with us too, Tauheed, today. So great stuff. Thank you. Let's get at the questions. You mentioned marketing. This parent asks, could ease of access and awareness of marijuana use to marketing and remote home delivery be a factor in rising rates? This parent notes that she's seen her 16-year-old get home delivery in San Carlos.
What we know from research into other substances is that whenever there is increased access to a substance, rates of problems related to that substance go up. One of the really kind of interesting pieces of data around alcohol is that the more bars, for example, a neighborhood has, the higher the rates of alcohol use disorder, right? So there is this effect that access can have on rates of problems. Now, in this age of kind of technology and of app availability, which just increases access so much, I would absolutely anticipate that ease of access would lead to potentially increased problems amongst all people, but particularly amongst adolescents who, let's face it, might be more likely to use apps or more proficient at them than someone my age or older. So I am absolutely concerned about that risk. And also, somewhat harder to measure, the perceived safety of cannabis, right? It's hard to think of something that you can get delivered by an app as being particularly dangerous. So I think we need to be aware of that perception.
So true. I remember we had a sheriff from San Mateo County used to come out and do these talks with actual drugs and paraphernalia. And he would say, I'd sit at lunch and I would be with somebody and I'd say, who's going to get it first, cannabis or the pizza? And invariably, he'd get the cannabis first.
Yes. Yeah. Isn't it remarkable?
Yeah, it is. So kind of in that same vein, here's a parent who asks, my son says marijuana cannot be addictive since it is a natural plant-based product. Is he right?
It's such a good question. And it gets to what is an addiction, right? And when we step back, you heard me mention all of those medical diagnoses and criteria, but when you step back and think about it, big picture, an addiction is ongoing use of any substance despite consequences. And that substance can be organic, that substance can be inorganic. It doesn't really matter. As long as it's ongoing use despite consequences, it can be addictive. And what I would point to, for example, is nicotine or tobacco, right? We know that tobacco actually comes from the tobacco plant, which is also a natural product. And I think many of us would agree that nicotine is quite addictive and has a lot of kind of health concerns despite being a natural kind of plant-derived product. So what I would say is that it's important to think about is this ongoing use despite consequences, even if it is a quote unquote naturally derived substance.
Exactly. And 2 weeks ago, we had your friend, Dr. Anna Lemke, on with us talking about science, excuse me, of addiction. And she pointed out that video games certainly can be addictive. Anything that gives you a hit of dopamine is liable to do that.
Absolutely. And I noticed in the chat folks mentioning sugar and cocaine, which were the other two I was going to mention. So you all beat me to it. Those are other examples.
All right. So now we've been talking about brain development here today, and I think this is a really good question. You touched on this. For college kids, are the risks similar to 12th graders as the brain is not fully grown until age 26, or is it different?
Great question. I think as a society, we've come to think of as the age of 18 or however old someone is, sometimes even 17 when they go off to college, as being such a social milestone. That they're out of the house, they're independent, they're out on their own. And so they're young adults, essentially. We don't think of them really as adolescents as much. However, it's important to know that, exactly what you said, Charlene, which is that brain development is continuing often till long after college, right? So, what I say to my colleagues, I thought my brain was done developing once I got into grad school, but gosh, no, it wasn't. It was still going till at least the age of 26. So important to know that even though socially we might think of people as being adults and fully formed and independent, brain development continues longer. And so, yes, it can absolutely be risky for college-age kids. And I'll also briefly mention that some psychiatric conditions emerge in those early years and those early college years, including psychotic disorders and addictions. So we always want to be aware of that with our college-age kids.
All right, very true. Here is a related question that is on a lot of parents' minds. When my kid says, I'm only using cannabis in moderation, how should a parent respond? What is a moderate or safe amount for kids, say between 18 and 21?
Great. This is such a good question, and I will tell you, I get this question often, and I kind of hem and haw, and I say, well, there are no research that any amount is really safe for someone whose brain is still developing. Risks, the actual risk depends on your personal history, your family history, your own conditions, and inevitably the adolescents and their kind of tired parents says, look, just give us a number. Give me, is it every morning? Is it on the weekends? Just tell me what's safe. And so this is what I say. I say, look, the evidence are that any amount is risky over time. However, the riskiest use is daily and high dose use, right? So anything you can do to not use every day or to use low potency, small amounts occasionally, that will be protective, right? And I say, keep an eye on it. First of all, parents are absolutely empowered and appropriate to say that the only acceptable amount is 0. That if you're in this home, you're a minor, the amount is 0, and that's my rule. I think parents have every right to say that, of course. However, parents can also choose, in some cases, to work with their adolescent and say, okay, how will we know that it's not becoming a problem? Will it be your grades? Will it be how you're doing in sports or arts or other extracurriculars? Will it be your sleep, your appetite? What are we going to keep track of? So in those cases, when adolescents can't cut down, I think, or can't stop, keeping a harm reduction approach in mind and tracking it closely is crucial.
All right, thank you. That's a question that we're getting a lot. So this question comes from our partners in San Mateo County, Tupay and Sequoia Healthcare District. There are a large number of dispensaries, new ones, being proposed for Redwood City. How much should we, as educators and parents, be concerned? Are those dispensaries going to increase use in our children and adolescents?
The push for dispensaries is occurring in towns and cities of every size across all of this entire country. I live in a community here in the Bay Area which has struggled with this because the local city councilors have gotten multiple presentations from dispensary owning companies saying cannabis will generate this much in tax revenue for you. This is how much money you could get for your schools. And also it's not really that risky. Look at all this data showing that it's not risky. And also we promise we will be so careful not to, make sure no product gets into the hands of adolescents. Now, those are promises that are easily made and challenging to keep or hold people accountable to. So what I would say is that knowing that the more prevalent and accessible any substance is in a community, including to adults, the more potentially accessible it will be to adolescents and will also reduce the risk of the perception of risk for adolescents. That is cause for concern for educators and from parents. And I think it's really important to talk to the local authorities, to talk to city officials, elected officials, and say, okay, if you're bringing in these dispensaries, how are we protecting vulnerable populations, including adolescents? And are more services being put into place for those who are going to end up, unfortunately, inevitably, with cannabis-related problems?
So on a related issue, we are getting a few questions from parents who say, well, what if my husband likes to use weed at night to relax or go to sleep? Should parents not be modeling that? Do you take a 0% approach, or should it be okay? It's really hard now in states like California where marijuana is technically legal, although it's not for youth.
Yes, yeah, it's such an excellent question. And what I will say is, I think this is an individual parental decision. One thing I've learned in medicine and in life is to not tell people how to parent. Parents are the best authority on their kids. And so, what I would say is, look, what we know is that the effects on the adult developed brain, right, so after the age of 26, is very different than the effect when the brain is still developing, right below the age of 26. So something might be safer and perhaps even therapeutic for an adult, for sleep or some other indication. Maybe it's a higher CBD product, and lower THC, that may be therapeutic and safe for an adult. However, the developing or adolescent brain is a different brain. It's a more vulnerable brain. It's a brain that is still myelinating and forming those neural connections. So I think it can be important if, for example, if a parent is using a cannabis product medicinally, to be clear about why it's safe or appropriate for them, but not for an adolescent. There's a reason, for example, the legal drinking age is 21, right? So that there are templates out there in relation to other substances.
That's right. And we know that modeling is such a powerful impact for kids. So that, again, parents, it's a tough one. It's a really tough one. Individual.
Absolutely. Yeah.
So what about the teens who have been prescribed medicinal marijuana for anxiety or sleep disorders?
Mm-hmm.
What do we do with that question?
Great question. And I'll tell you, unfortunately, there are doctors out there who will do it. I think someone put in the chat that, someone can spend $100 and potentially get a marijuana prescription. I think it's really important to know a couple of things. First, there is no psychiatric condition for which a cannabis-derived product has been adequately studied to be helpful, right? We talked a little bit about the APA's statement, which, and I take professional, society statements seriously. They're based on a lot of research, but I will tell you, just having been a psychiatrist in the field and asked this question of many other colleagues as well, there has been no psychiatric condition for which we've seen cannabis be consistently helpful. Oh. And it is also, it's hard to track something that is so variable in terms of what's in there, right? So I think it's important if adolescents are saying, okay, no, I'm using it for anxiety, or I'm using it for insomnia or concentration, to say, okay, are there actually medical data showing that it works, and have you talked to the appropriate medical professional to make sure that you are taking the appropriate thing for the appropriate diagnosis? And that's sometimes not the case when you're paying someone for a medical marijuana prescription.
Absolutely. So this question comes in, Tauheed, from one of our partners. She asks, can you ask Dr. Zaman to warn parents that it's very easy for an 18-year-old to get a medical marijuana card? Can you also ask if he has heard of neuro-optimal feedback for the treatment of addiction issues?
Great question. A couple of points, and I actually think many of the parents on here may be unsurprised to hear that point, that it is quite easy for someone who is 18 years old under state law to obtain a medical marijuana card, and therefore gain access to that entire spectrum of products that I showed in my talk. And now that is concerning, right? Not only is it easy, but gosh, 18 is a long way from 26, right? So someone who's 18 who gets full access to all of those products and maybe escalates their use might be affecting their prime years of frontal lobe development. So that's really important to know, right? In terms of that treatment modality, I will say I don't know more than that I've heard of it. So I can't speak to something that I am not fully up to date on the evidence for, but I've heard there's reasonable evidence. I don't know more than that, so I apologize.
Okay. Many parents are worried about kids going back to school now. In a funny way, we kind of had a hiatus with kids at home where we could keep a close eye on them. But going back to school, we know that school-based access is going to increase again.
Absolutely. Yeah, I think it's a concern that I share. I shared that data that in 2020, some of the use in some groups actually dropped, probably because of reduced access and being around parents and being monitored, right? And I think there are a couple of things there. I think there's reason for concern and there's a reason for hope. The reason for concern is that, yes, there will absolutely be, first of all, easier access once they're in school and have access to peers with cannabis, et cetera, but also increased stress, right? We expect all children and actually adults to have a re-entry syndrome where the world is opening up and it's stressful and anxiety inducing and kind of scary because we're not used to it, right? So will they turn to cannabis to deal with that kind of re-entry anxiety and stress? So those are the reasons for concern. However, there's also, some reason for hope. I would say some families and adolescents have had a chance to see how the kids really do without marijuana in their system. Maybe they're more active, maybe they're more engaged with their families, maybe communication is different or better. And so could it have been a really helpful educational time for families to learn those skills and maintain them even as schools open up? I really kind of hold that hope that that's possible.
Absolutely. And I think that is a perfect place to end today. Dr. Zaman on a point of hope, because that's what we're all looking for as parents. We really want to thank you for a wonderful presentation today, and you attendees for great questions. I wish that we could have gotten to everyone. We've done our best to get to as many as we could. So again, everyone, stay safe, stay well. This recording will be available on our video library. We will send that link out to everybody. Takes again a few days for the team from the Boys and Girls Club to post it, but they will. Huge thank you to Dr. Tauheed Zaman for today's presentation. Just a wonderful event. Stay safe, stay well, everybody, and we hope to see you again soon. Panelists, if you can stay on for a minute. Tauheed, if you have to go, we understand, okay? So otherwise, we're going to say goodbye to attendees. If you could sign off now, and panelists rejoin us. Thank you so much, everybody. Great to see you today.